Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us discuss that in poor ovarian reserve patient or in decreased or diminished ovarian reserve patient, which is a better biomarker, your serum AMH blood value or your antral follicular count sonography, which is done in specialized IVF centers. Now, because of different circumstances now, or preservative rich food, or the lifestyle which has changed dramatically in these few years, there are a lot of patients who come to us with a very low ovarian reserve in younger age groups. May it be even 30-35, patients are having AMH as low as 0.5, 0.8, and it is actually a national concern for all the IVF specialists in India at least and throughout the world. Now, what is this AMH? We have seen in our previous videos that AMH is a blood hormone which estimates the amount of follicular recruitment that can happen in your ovaries. This AMH value can be plus minus because of other conditions as well, and hence it is not very sensitive or not very reliable. Though when a patient comes with an AMH in 0.5, 0.8, effectively when the AMH is less than 1, it indicates a poor ovarian reserve, and we definitely have to question whether the lady can conceive with her own oocytes or not. Which means, in short, that it is an emergency that you visit your IVF consultant and discuss at length. What is this antral follicular count? Antral follicular count is a much better and a superior biomarker, which is a sonography which is done during the period 2nd or the 3rd day by specialized IVF specialists in IVF centers. It is a transvaginal sonography which tells us the number of recruitable follicles in that particular cycle in the current scenario. So basically it is nothing but the present situation, whether you can have recruitable follicles or not, or if you start an IUI or IVF treatment, will you get adequate number of follicles, is it a good prognosis patient, or we are not very sure whether you will sail through. So all these parameters can be accurately assessed with the help of a good antral follicular scan. So, should we believe on our AMH more than AFC? No, it's the other way round. Your AFC is much superior as compared to any blood test, because it will tell you the actual figures and actual number of follicles that can be developed in that particular cycle. So, if you have a low AMH, a low AFC, please don't sit at home, go and see your IVF specialist and start your treatment right away. Thank you.